all these wonderful panelists come up and share interesting anecdotes. What could I say that would sort of start this off in a really interesting way? And I also wanted to share an anecdote from last night. I also have 2 young children. And as I'm standing up here this morning presenting this talk, my 7-year-old is also standing on a stage doing a presentation of poetry this morning. And so while I'm very sad that I'm not there to support him today, his father is, I'm also very delighted to be here. And so I asked my son last night what was sort of his rule for himself as he got up on stage, and did he have anything to share with me? And his advice was to talk very, very loudly. So I'm going to attempt to do that today. I think it's something his 2nd grade teacher actually told him to do, and I'm going to attempt to do that. So if you can't hear me or if I'm too loud, please do let me know. So the title of my talk is Community-Based Participatory Research, Implications for the Mental Health of AAPI Populations. As was mentioned earlier, my name is Shalini, and I'm a researcher at the Institute for Community Health, which is a small research and evaluation organization based in Cambridge. We were founded in 2000, and our focus is really on working in partnership with local public health departments and community-based agencies to stimulate the creation of innovative programs and health policies using a community-based participatory research approach. So are there folks in the room, and I'm sure there are, who are familiar with Cbpr? Have you heard this term or concept before? So there are many ways to define this concept, but it's a partnership approach to research that equitably involves community members, organizational representatives, and researchers in all aspects of a research process. And I think it's important when we're thinking about Cbpr to break down that very long and large term. So when we say community-based, we're essentially meaning something that's working in response to the needs of a community. And when we say participatory, that means that the community is part of that process. And of course, research is the systematic investigation that develops or contributes to generalizable knowledge. I think one of the misconceptions about Cbpr that I'm hoping to dispel today is that Cbpr is actually a method, which it is not. It is an approach to research that can incorporate multiple methodologies. And I think it's important for us to recognize that. The purpose of Cbpr is really to transform research from a relationship where researchers come in and act upon a community to answer a research question to one where researchers work side by side with community members to define questions and methods, to implement research, to disseminate findings, and finally, what I think is really most important about Cbpr, to apply those findings and generate action. Whenever we talk about Cbpr, someone inevitably in the audience will raise their hand and ask, what do we mean by community? How do we define community? And that's a great question. A community is a group of people who are linked by social ties, who share common perspectives or interests, and potentially even geographic locations. So an example of a community could be a group of Asian immigrants, or Chinese immigrants, or Indian immigrants. It could be a group of primary care providers. I think the important thing to recognize is that communities are not homogeneous, and they rarely speak with a single voice, and that there's a lot of diversity within communities. So what are some key principles of Cbpr? I think the first key principle is that it's important that we recognize community as a unit of identity. It's also important, if we think about Cbpr principles, that it's about building on community strengths and resources. It's about assets, about resiliency, not about necessarily just illness, but about wellness as well. Cbpr is about facilitating collaborative and equitable partnerships. There is nothing more critical to Cbpr than this idea of partnership and collaboration. And that partnership and collaboration extends to all phases of the research process, and I will share with you those phases in a little bit. And again, as I mentioned, it's about integrating knowledge, about integrating data and action. CBPR is about generating actionable knowledge, not just about collecting data or statistics or findings for the sake of collecting data or statistics or findings, but it's about taking that information and applying it to make changes in programs or policies. The other really important element of CBPR is that it's about promoting co-learning and empowerment. So in a CBPR partnership, the academic researcher or the academic partner is learning from the community member, and the community member is learning from the academic partner. It involves a cyclical and iterative process where data is not just held on to and published at the end of the process in a peer-reviewed manuscript, but the data is fed back, so there's improvement, immediate improvement that's happening. It really is about focusing on local communities and talking about the local relevance of public health problems, and also recognizing that the local sits within a context, and that it's important to recognize the impact of that context on the local environment. And finally, it's about dissemination, about sharing knowledge, and not necessarily in the way that we think about traditional dissemination when we think about academic work or research. It's not just about publishing papers and moving on. It's about doing community forums, about writing newsletters, putting your findings in the media. It's about sharing knowledge in a way that is understandable and accessible to a variety of populations. I should mention those principles were taken from the literature, but I think what's important to recognize is that in any CBPR partnership, how you apply those principles really depends on the nature of the partnership. So they can be applied really, it's really sort of unique to the relationship or project that you're working on. So what is the CBPR research process? It's kind of similar to the research process when you're sort of thinking about traditional research. The first thing to do is really identify what the question is that you're interested in learning about. The unique thing about CBPR is that question often doesn't come from the academic. It actually comes from the community. There's something happening in the community that's bothering somebody. There's a trend or a pattern or a collection of anecdotal information that's really bugging someone or a group of people. And so from that emerges a really great research question. And so often in CBPR partnerships, the community will find an academic researcher to partner with. So once you have a question, the community and the academic partner can sit down and sort of brainstorm the method that they're going to use to actually assess the question. And what's important in CBPR is this could be a quantitative method. You could use surveys to get at what you're trying to get at. But it could also be qualitative. Maybe what you're trying to understand and study has very little out there in the literature, and so you may want to sort of collect more formative data. You may want to interview people or talk to them or do focus groups. Then obviously you implement your methods through data collection, and then there's an analytic portion where you interpret the data that you've gathered, and all these things that are done in these sort of green boxes are done in collaboration with partners and academics. There's the dissemination component, and then finally the action component. Now that we have this information, it's been collected, what do we do with it, and how can we make change? So why utilize CBPR in the AAPI, got that acronym right, AAPI context? Many of the speakers before me talked about the limited data that we have on this population and the fact that aggregating the data can really obscure some really important differences within the ethnic subgroups and perpetuate this model minority myth. CBPR is about recognizing those unique differences. And so it's a really great approach to studying these issues in this population. AAPI populations often cluster into tightly knit communities, and CBPR recognizes the importance of these communities and the importance of local context. The other piece that's really important about CBPR is this translational element. It's about translating research into action. And so what this has the potential to do, if you're doing a project in a community and you're partnering with local stakeholders or community partners, the work that you're doing and what you've learned is in some sense more valid and translatable and more acceptable to the community. So you can take those findings back from up here and bring it back down to the community and have it be applied. more successfully and in a more acceptable sort of way. Cbpr is very much about building community researcher trust and respect. It's really integral. And so you, through this process of building trust and establishing shared goals and objectives, you are able to sort of get more buy-in and ownership of the project and the research from the community perspective. And the other thing I also mentioned is that Cbpr, because it's not a method but an approach, really utilizes a variety of study designs and methodologies. And so what you're essentially doing when you're asking the same question in all these different ways is triangulating what you're learning. And the other piece of this that's really important, that it's really about strengths and not deficits, and really understanding mental health and wellness. And the qualitative methods that are often used in Cbpr can really allow you to get at those concepts. So every wonderful approach has its challenges. Developing trust is can be a challenging endeavor. Cbpr takes a lot of time. It really requires a lot of effort from all partners. Some people would argue that it is less scientifically rigorous. It is not always feasible to walk into a community and implement a randomized controlled trial. I have thoughts on that, but I think, you know, so I'll keep moving because I'm almost out of time. But there are clashing perspectives and responsibilities. You're not talking about research that's happening in a laboratory. You're talking about research that's happening in a community setting. You cannot control all the variables. Access to and ownership of data. If you're coming into a community and collecting data, who owns it? That is a very important question. And obviously the changing context. You cannot ignore that and its impact on your research. I'm almost done. I thought it was important to sort of bring back Cbpr and sort of relate it to the other tracks that are mentioned in the blueprint and also represented on this panel. We can use these types of participatory methods to study integration, to study the impact of integration. Is it working? Who is it working for? How is it working? We can use it when we think about workforce development. How can we build the capacity of staff and providers that are providing care to these populations? How can we engage them in research so they're studying what they're doing? And so our questions that we're asking of their work are more informed by their practices. And finally, in terms of thinking about consumers, how do we engage consumers in this process so they're not just passive participants or as subjects, as some people like to call them, in our research studies, but active participants in the process of defining the research itself. I'm almost out of time, but I wanted to actually share with you a small example from a project that we did in an urban community in Massachusetts a couple of years ago. And it was a DPH-funded project to conduct a participatory needs assessment of 3 Asian communities, ethnic groups who lived in this urban community, the Chinese, Vietnamese, and South Asian populations. And this is a very busy slide, but I'll walk you through it really quickly. So in this instance, the community partner, if you look at box number 1, received funding for this project. And they approached us as the academic partner to partner with them on this effort. We convened a core team of partners, of academic and community partners. We reviewed the literature to try and understand how do people get at this concept, what are some of the issues we're talking about. We participated in a visioning exercise, and the focus of this was really to think about what is working well in this community. We didn't want to start out with this deficits approach. We wanted to ask what works well and how can we make that happen more. We decided collectively what the best data collection strategy was, and we did some interviews, and we also used those interviews to develop a community survey that was implemented. We administered the survey, and then we analyzed the data. And we repeated this process because we had 3 years of funding. We repeated this process twice. At the end of our second year, we realized that rather than just go out and collect more data on another community group, what we wanted to do was take what we learned and spend the third year sharing it back. And so we changed our strategy, and this is where working in a Cbpr project, you have to be flexible and sort of go with the flow. Our community felt like it was really important, that it wasn't just about collecting the data, writing the paper, and moving on. So we shared our findings in a very large community forum that was attended by over 90 members of the community. We held it at the local high school. And people talked about what we learned, we shared what we learned, they got up. And what amazed us in particular at this forum was the loud and powerful voice of the young people, who were not really the focus of the community survey. We actually just focused on adults. But so many young people stood up at the end of this forum and talked about their experiences with mental health and how this was such a huge priority for their community. And so it was a really compelling and wonderful experience for us. And actually several of our community partners are in the audience today, and you'll hear from them in the afternoon at the Cbpr breakout session as well. We did a presentation to some health providers, and we also did ultimately publish a manuscript that was actually co-written and co-published with the community partners and the academics. I just wanted to show you a quick little picture. So at the forum, we sort of, based on our survey, we'd identified several health issues of concern in the community. And we thought, why don't we have the members of the forum vote on the issues that they thought were most important to them? And so we put these sticky sheets up on the screen, on the walls, and gave them sticky notes, and they voted. And the two issues that they thought were important priorities for their communities were healthcare access and mental health. And so what's remarkable about this is that instead of us going in and saying mental health was a problem for this population, they told us mental health was a problem. What came out of this were several new community academic partnerships. Several of the community partners at the table included mental health elements into their local programming as a result of this. We also, I think, increased the awareness of local providers around the mental health needs of the Chinese and Vietnamese communities. And I'm happy to report that one of our community partners recently collaborated with us, and we received a very small pilot grant to sort of look more carefully at the youth and sort of what their perspectives are on wellness and mental wellness. And so we'll be embarking on that very short project over the next year. But really a terrific experience. I think we all learned a whole lot. And it was really an honor to sort of be welcomed into this community to do this project. And so I'd just like to acknowledge a few folks, and that's it. Thank you.